and we are back with the dental guys jointly presenting this with the Academy of Osseointegration, and we are here with Dr. Tara Aghaloo. So let's bring her on the show. Welcome, Dr. Aghaloo. Thank you for being with us today.
Thank you so much for having me. Really excited to be here.
We're excited too. One of the last lectures that I got to see live was actually your lecture, University of Tennessee. This was back in 2019, back before the world ended, or seemed like it was ending. And you came and talked. We're going to be kind of coming back to that, circling back to some of the research-based topics. One of the reasons why we love the Academy is because of some of the things we get to talk about uh, with the science and the nuts and bolts. So we're going to be circling back to that, but super excited to have you on. And first thing we want to talk about is obviously what's coming up with this Academy meeting. It has been a long time since we've had a meeting. It seems like forever. And you guys are bringing, I feel like, everything you got here in a good way. You know, we're really pulling out all the stops. We've got some great speakers. We've got a great lineup. Tell us a little bit about some of the things you're excited about for this upcoming Academy of Osseointegration annual meeting.
Well, great. I mean, thanks for having me, and I'm super excited to talk about our meeting. I agree with you. I think this is going to be the real first meeting back for most people. I mean, there have been some meetings, definitely. I've been to a few that are smaller, but this is the first big blowout, and I'm really excited that it gets to be our AO meeting. I'm, excited about the title. It's really about implants, everybody getting involved in implants. We're going to be treasuring the past. We're going to be treasuring the present, honoring the past, and really looking forward to the future. It's really about all of it, where we've come from, what we've learned, what we're all doing now, and what the future holds. And so I think that we put together some great speakers. Herman Gallucci is the program chair, and we've worked really closely with his committee and, our industry partners and other organizations, and really just getting everything going and prepared for February. So, we really couldn't be more excited and ready to see everyone in person. I mean, I think the meeting's going to be awesome, and the speakers are going to be great, and the program's going to be nice. But I think most people are really excited for the social events and all the camaraderie and the colleagues that they haven't seen for 2 years. So I think that it's okay that that we're more, at least as much looking forward to seeing each other really are the meeting, and I'm okay with that. I think that everyone's going to have a special reason to come to the meeting. And while I think a lot of it is honestly the science, the innovation, and the clinical pearls that you'll get from being there, I really think people are going to be excited to see each other. And with that, we've just created some awesome social events that people will be really excited about.
The title of the meeting this year is Implant Dentistry for All. Tell us a little bit about that title and what's going to be done to kind of culminate that and bring that to light at the meeting.
Well, we really want everyone to get excited about implant dentistry, whether you're a general practitioner, a specialist, an allied staff, whether it's lab technician, hygienist, implant coordinator, assistant, student, postgraduate, resident. We really want everybody to come and get involved, researchers, everyone. And so we want to honor the past and really where we started and how far that we've come in implant dentistry. What makes it so successful? How do we continue to innovate? What are we doing now in the industry? Where are we with soft tissue and hard tissue grafting, with implants, immediate loading, and surfaces, and really all of the different things that we're doing now in terms of techniques and technology. And then where are we going in the future? What kind of business models and practice models are we going to have? How do things of the future, such as artificial intelligence and other things, I mean, how does all that come into play? And so I think that there will be something for everyone at this meeting. And so I encourage everyone to come, and I think they will. I mean, the response that we've been getting around the country and around the world has just been amazing, and everyone's really excited, as am I, as maybe you can tell. I mean, I can tell you guys are excited, and you could probably tell that I'm super excited
Yeah,
too.
absolutely. We were slated for the last meeting in Seattle we were going to be speaking there, and so we're able to record that, do that online, which was still super cool. Honored to be able to do. This sounds like such a crazy thing for those who didn't get to see it, but before COVID hit, right? Wes and I had this discussion that we were going to present on, is online education or online meeting space the wave of the future, or is it really that that this could take away from the profession? This is before everything really changed, and I think that while we've gotten so much from the change in terms of things being presented online and being able to get so much great content, and you alluded to this early on in this discussion, that just seeing each other and being able to be face to face and sitting in a room and listening to some of the great speakers that we'll have, there is something about it. There is something about it. And that's what Wes and I kind of uncovered. We talked to some experts on, how people process information and really learn complex subjects and talk about, problem solving. And there's sometimes no replacement for not only the in person. I'm not saying you can't do a lot without it, but there's something about the coffee break, right? There's something about the social side of it, of coming together at the end of the day, having a drink with your friends and saying, hey, what do you think about that implant? What do you think about that technique? Is that what you're seeing? Because that's either not what I'm seeing, or that is what I'm seeing, or what are they doing in Germany, or what are they doing in Sweden? Speak to that a little bit, as to the value of the in-person. Why should people come to this meeting? Because I think we've gotten in this groove a little bit of just, oh, well, we'll just take it in from our couch. So what do you feel about that? What's this meeting bring? Is there a value in that in-person side?
Oh, that's a great question. I mean, I think that you're right. We have learned. And I think when we were probably, 6 months or maybe a little more into COVID, I said, I wonder if meetings are going to change and if we'll do much more online. But and I think there are some things that we can do, maybe face to face meetings in a small group or something like that, I think are great. But these big meetings have been really missed, and it's not the same. And one of the things that I'm sure that I'm definitely guilty of is tasking when I'm on an online meeting. Sometimes I probably shouldn't let any of my bosses hear that, because they want to know that I'm paying full attention all the time with what I'm doing. But when you're online, you sort of think, well, I can check my email at the same time, or I can do something else at the same time, and so I don't know that I definitely feel that I'm not as creative at a meeting, and I'm not really thinking of, well, how can I, take what I've learned from this lecture and apply it to, either my clinical practice or a new research question or something. It's really that interaction and that being there, being able to go up to the speaker afterwards and talk to him or her about that, and generating these new ideas and the dialogue. And that's definitely missed. And I know that that's something that we all really cherish, and even more so now because we haven't done it for so long.
Yeah, yeah, absolutely, absolutely. And
One,
I think that's the thing that I was hoping you would say. I think that people feel that way, like you say. I mean, I don't care who you are. When you are plugged in, you can have the best speaker in the world, the most accomplished clinician. But when it's especially pre-recorded video, or even if it's not, even if it's live, it's difficult. There's something about the accountability, and that's what Wes and I kind of talked about, the accountability of being in a room where the way you react and the way you interact is seen, and you kind of have to engage. Or why are you there? Right? Like, if you're there, you should, you want to be engaged, because that's the whole idea. I wonder. I think about dental school. Obviously,
mm,
you're the dean at the dental school there, and have been involved in education for many years. And I wonder, as we kind of talk about this topic, and what does that Tell us a little bit about what's happening from the dental education side and that same realm, the same things we're excited about with the meeting, obviously the return back to in-person classes and something we never thought we'd be talking about, post-COVID era. What have you learned? What are some of the things that you're doing there at UCLA? What are some things that you're seeing in the dental education community that are changing as a result of COVID? And how do you feel that's going to shape the future of education?
Well, I mean, that's a great question too. I mean, we were, obviously in lockdown and the students weren't coming in for quite some time. And so all of the lectures were pre-recorded. We had small group sessions. But our students early on, I think they were okay with it and they were kind of happy to go home and have a break and still be able to learn. And I think that at first they really liked it. It's forcing a lot of my professors to put their materials online and give us something pre-recorded that they could watch at like 1.5 to 2 times speed and get through it faster, of course. But they really liked going back and being able to watch something again and do that. So I think it was great in that way. I mean, as someone myself who often didn't put my whole PowerPoint available online. I would make a PDF instead of for the students, or I would always want them to be in the class lecture. I wasn't really excited about just putting my lecture notes up or whatever. And so now, obviously, we've adapted to that, and all of us, even maybe the late adapters or the people who aren't so tech savvy, have now been able to do it. We all can record on Zoom or voice over PowerPoint, and the students really like that. However, they really miss the in-person interactions, and I think it's kind of worked in 2 ways. I direct the surgery track program for all students that are interested in oral surgery here at UCLA. And I started back, a few at a time in our clinic where they could spread out and do some more kind of hands-on skills and discussions in groups. They learned how to draw blood on each other and start IVs and suture and those kind of things. And from the first years to the fourth years, and they just loved that. I mean, they weren't really getting to have any other interaction other than that, and so they could, with masks on and social distancing, they could see each other and they could, interact and ask questions, and we could talk about things. And so that was really fun. And I said, this is really missed, even though I think the students like having all of their materials that they can refer to. They missed that. The other thing I think it did is it sort of made us expect more from the students, because if we're giving the lectures beforehand and they have this pre-recorded, and then maybe we're meeting in a small group discussions, we're expecting that they've read the material and they've gone through it, and now we're having a more high level discussion. And I think that if that works and if that's what we're doing, then that's a great use of, our Zoom or pre-recorded lectures. But a lot of times they're really busy, or life gets in the way, or maybe they're thinking about it like it's a little time off rather than, studying. And so then a few times I find that maybe they're not as prepared as I would have liked them to be, especially because we did provide the materials ahead of time. So it's sort of, I think it's a balance. There are some things I think that have improved, and I think there are some things that maybe we all miss from the in-person.
One of the things that's interesting about dentistry is that the didactic knowledge is immediately paired with practical hands-on application. And we know that 4 years, sometimes what we need to know crammed into 4 years just as a, DDS or DMD program, it just seems like maybe it's not enough time. And what I like to hear you say is what John and I kind of discovered during our research of what seemed to be working, right, in education, which was what you described as what we call the hybrid model. Mm-hmm. This hybrid model of education is core knowledge is kind of consumed via maybe online or away from a lectern situation, or even in a classroom situation. Maybe it's digested on your own time. But then once that core knowledge has been disseminated in that form, then collaboration happens. And like you said, it's almost expecting more of the students, because when you arrive, okay, now it's time. We've got the core knowledge. Now it's time to get down to how do we apply this, right? And
Yeah.
what is the critical thinking skills, right? Because I feel like dentistry is an activity of critical thinking all the time. And it's taking that didactic and applying it through your hands and your eyes and critically thinking as you're going. Speak to that. How is it working? Are you looking at taking and changing maybe education? Really, I think that's the question I have, because we've been talking about our educational model for some time on our show, and we're excited to see what's to come because of what we were forced to do last year. Because
is it going to change it forever, or are we going to see it essentially go back to where we were? Is this a long-lasting change with this, with the online preparation and then the critical thinking in the classroom? We're really interested to hear your.
The students want to have more of their own time, and they don't want to be micromanaged. And we don't want to micromanage them either, right? I mean, when you're in professional school, you really have to expect a specific sense of responsibility, and that the students are going to learn these things and go through them on their own, because they're going to be practitioners in a few short years, right? So if they're not doing it now as professional students, how can we be sure that they're going to do that when they're in their own practices? We have to be confident that when a practitioner sees a patient with a disease that maybe is newer that they didn't learn about in school, or on some new medication, that they're going to go and know where to get the resources and go over it on their own and then come back to the patient, right? So I think that starting to enforce those things now is really important, so that it will set up those types of learning models forever. Because in the profession that we're in, no matter if you're a general dentist or the most highly trained specialist that went to a million years of school, you're still going to have to learn things later on. And so we have to have that ability to do that and to figure out where to get the right info, that we're not going to Wikipedia for,
Right.
no offense to Wikipedia, but that we're not going to a super non-scientific place to get our information that we're then going to turn around and use on a patient.
Well, that's cool. It sounds like you're leveraging, kind of the best of both. The idea that we can have this vast, storehouse, if you will, online of a ton of just basic knowledge, and things that are memorization, things that are basics that we can just say, hey, this is, you have to memorize the following terms in order to understand, just so you can speak correctly about the discussion we're about to have. Use the proper terminology. But then when it comes to the discussion, it's still the same thing we've been doing for thousands of years. It's, coming to the classroom and discussing and debating and citing and having a backing for what you think about things and having that be challenged. But it's interesting to hear you say that it's more of an independence, idea, that there's maybe less micromanaging that comes out of that. And there is a little bit of a generational thing to that. And we could dive into that super far, which we won't, because it's a whole different discussion. But it's interesting that, whether it's for good or bad, that's debatable, on micromanaging, whether it truly is micromanaging or whether it's just, a difference in how we feel about the way we're being managed. It depends on probably when you were educated.
I needed to be a little more micromanaged. I'm not sure that I would have been as great in school
Right.
as I was if I wasn't micromanaged.
It's easy to think, and I mean, right, you probably have some students listening to this, they're like, I don't need that. I think we all maybe thought that when we were a certain point in our lives, and then you realize, again, you don't know what you think. YouTube has been a little bit harmful in the end, when it comes to the underestimation of how quickly we can learn something. It's a
Oh
little
yeah.
bit more difficult than a 2-minute video on how to take out thirds, right?
Oh my
So
God, our residents and students are watching YouTube before they do a procedure, and I'm like, oh my God, we should probably be like looking at those and making sure they're doing it right before they learn
yep.
how to do it from
Hear it
there.
all the time. People are we teach some stuff sometimes, and people come in and like, oh yeah, I watched some videos right before. I feel real good about this.
Real
Okay,
good.
let's make sure we
Hmm.
know where this is coming from. So
Yep.
so let's talk about. I mentioned at the beginning of the show that one of the last meetings I went to, or one of the few that was a great didactic lecture. You came and spoke at the University of Tennessee Medical Center with Eric Carlson, and
Hmm.
we're talking about, among other things, an update on a very interesting topic to many of us, especially in Europe, but I think kind of slowly making its way more and more and more into the U.S. market, which is zirconia implants. And we've
Hmm.
talked about this on the show a few times before with a couple of implant manufacturers. We've talked about it with some folks, especially out of Germany, who are doing a lot of innovation in zirconia implants. And you spoke at that meeting about kind of what your group has been looking at as far as different designs. And I think that that'd be a great discussion to have while we have you here, because you're not going to get away on this show, on the Dental Guys, without, we're not just going to ask you what your favorite ice cream flavor is. We actually read the journals, and we care about that, and we love this stuff. So what I'm interested in is maybe first, as we start unpacking this, because obviously there's tons of stuff we could talk about, but let's maybe keep it to some of the most common questions that we have, or that we talk about. Number one, let's talk about the two kind of main types of zirconia implants. We have one piece and two piece.
Yep.
And I mean, that's a very broad, I get, generalization. There's lots of different ideas of what types, different materials, and different combinations of zirconia and titanium. But let's just keep it as to one piece and two piece, because initially we had mainly one piece zirconia implants. And I think that was mainly for strength discussion and reasoning. Where are we now with one piece versus two piece zirconia implants? What success and failure rates are we seeing? And let's maybe define that a little bit. And then maybe we can talk a little bit about application, where you see the applications being. But what are some of the types? What are we seeing? Are these working? And what should we be thinking about these?
I mean, absolutely. I think that, when this started, it was kind of just maybe only for patients who either had some kind of titanium sensitivity or perceived titanium sensitivity, or people who just really didn't want any kind of metal in their mouths and were seeking out this type of implant. And for people like that, this was really a great option. And in Los Angeles, of course, we have a lot of patients that are more holistic type of patients, or really have a lot of allergies, or are really concerned about having anything metallic. And so those were the types of patients that we were seeing first, and utilizing these implants on. And you're absolutely right. The one piece, I think, was great because it was pretty early on available. But if there's some limitations, of course, with that. I mean, the placement has to be perfectly spot on. I mean, you really don't have any room for error. You can't prep in general. You really can't prep the abutment aspect of it, or the top of the implant. And so if your angulation is off, then that's certainly going to be a problem. And so I think that's one thing. I mean, it has to be a cement retained restoration, right? It can't be screw retained if it's one piece. If you're doing multi units with the one piece, we were really only doing no more than two implants for either a 2 or a 3 unit type of prosthesis, because how are you going to parallel a full arch with the abutments already connected to the implant, and not being able to use any angulation? Now, maybe if you planned everything guided and everything went perfectly, that might be okay, but that's really difficult to do. So I think that the two piece has opened a lot of doors. Of the major implant companies either have that they manufacture themselves, or they either distribute or have acquired ceramic implants. And so I think that all of industry sees that it's a big area that people are interested, practitioners and patients alike. I mean, it really started, I think, in our area here, as the patients coming and asking about it. And I don't know if that's how it was in Germany, but I think so. And they're definitely one of the biggest users in terms of countries where ceramic implants are utilized.
So are they working? Are they working? I mean, what are we seeing right now? Because early on, there were some failure issues with
Yeah,
certain
yeah.
studies we saw. Where are we now? Update us a little bit on that as far as what we're seeing as far as success rates.
Yeah, I mean, the success rates are much better than they were with the first and second generation types of zirconia implants. I mean, it's significantly better, and I think that's why the major implant companies have gotten on board with these because they are seeing that the success rates are very high. If you're looking even at some of the more basic science studies, the interaction between the soft tissue and the zirconia material is significantly improved than when you're looking at titanium, and that's not news to really any of us. I mean, our abutments are oftentimes and even more these days zirconia than they are titanium now, right? So we recognize that soft tissue interaction and the lack of inflammation and the better color match and responses of fibroblasts and keratinocytes and all that are excellent. And so carrying that on from not just the abutment, but then to the implant is also, it makes a lot of sense. I mean, if you have thin tissue, we're not going to be worried about the gray hue showing through if we have a titanium implant versus when we have a zirconia implant. We also are thinking a lot about aesthetics. I mean, in Los Angeles, the aesthetic zone is third molar to third molar, right? So everyone everyone's really concerned about aesthetics, and I think it's hard to argue with the fact that in a lot of cases, an implant that's white is going to be more aesthetic than one that's metal or silver or grayish color. And so I think that's one reason definitely, and the success rates are definitely higher with with this current generation of zirconia implants. And so we're very happy and very confident in them. But when patients come and they ask, are they as successful as titanium? And
Mm.
with the limited studies that we have, we can say yes, how they've been studied, but we certainly haven't been doing them this way, in the current generation as long as titanium. And so I always share that with the patient. We don't have longer than 5-year data most times, and a lot of studies are even only 1 or 2 or 3-year data, whereas with titanium implants we have 10, 20, 30-year data. So you can't really compare those, but it's
I,
like that with anything new.
I
Yeah.
think that's the indication for these in in our practice has been the patients that maybe have these sensitivities to alloys in titanium, the alloy that is titanium, and then the aesthetic patient, and the ones that I've completed cases on with my surgeon here in my town. The interesting thing that I've found as far as how that they are being marketed by companies is this lifetime guarantee. Now that's super nice. I really appreciate whenever a company does that to back a product, that if you have a problem, a failure, especially on things that maybe doesn't have that long-term 10, 15, 20-year track record like some of our titanium implants do, from way back when, at least some iteration of some type of implant we're using in titanium is being used now, and it's very successful. However, whenever our surgeons place these, I hear a lot of this, that the patient comes to me and says, hey, we know that this is, the expectation is that this could fail. And if it does, my surgeon has agreed to do it again, right? At certain, lower cost, let's say. And I think that that's a great way to help patients get into something that is expensive, because what we're seeing here is something that is very, very expensive for the patients to get into, and it's reserved for very special situations. And is that why, right, we're seeing a real problem with adoption in the United States? Now, in Europe, we might be seeing a greater adoption. Speak to the adoption. Why are we having troubles? Is it the fact that we have this issue of failure rates are assumed to be a lot higher? what's causing the adoption issues amongst our surgeons and placers?
Yeah, that's a great question. And I mean, I think a lot of it is, well, titanium implants are the tried and true, and we have great success with that. So in most cases, in the posterior, do we need to have a zirconia implant? I mean, I think that that's the case, and you're absolutely right. I mean, they are more expensive, and so we have to charge more. And the theme of our meeting is, we want every patient and every practitioner to be able to be involved in implant dentistry. And so in cases where we're making it more expensive and then we have restrictions and maybe we don't have as long-term studies, then that makes it a little bit harder. But I will say that a lot of the times, other than the patients obviously that come in and ask about it and have these potential sensitivities, I've also used it quite a few times in patients where I've had titanium implant failures where I just cannot identify a reason why.
Mm,
And
mm.
there was no medical reason, there was no surgical reason, it wasn't loaded inadvertently, there wasn't anything that I could find. And why did they have this poor reaction and then this failure? And so when
Yeah.
I, instead of just doing another titanium implant again, then I've done the zirconia implants in those cases, and knock on wood,
That's
the
interesting.
outcome has been better. And so I don't know if that's why. Maybe that
Ah,
particular patient had some kind of reaction of
John,
some sort.
we
interesting.
heard one of our favorite speakers, right, talk about this idea that, well, osteointegration really isn't integration at all, right? Or is it
Right.
this, right, balance of
Yeah. Acceptance and
rejection and
rejection,
acceptance?
discussion.
Right,
Yeah. Right.
yeah. And
Right.
so I wonder, right, this is a whole hole we could go down. And I
But I
love
think that
that.
I think the idea though that I'll be interested to see, when we can do more, especially I
Mm,
feel like with customized abutments, I think that's still
yes.
something that we're not seeing. There's still this kind of square connection in a lot of these. It's not quite the same internal connection we're used to. There's been so much, whatever you want to call it, nitpicking over who has the best connection and what is the best connection and how much does that matter, or is it just surgical placement and Lincoln vicious, it's soft tissue thickness or whatever it is. We could debate it for hours, but I think that with zirconia we're focused more on, okay, we have to have a certain type of connection because of strength, and we have to have a
Yes.
certain thickness, and so that limits us a little bit in our customization. It limits us a little bit in our connection design from a standpoint of so much tightness as it is. Well, does the biocompatibility of zirconia overcome the difference in connection? And I think that that's where, but then I hear you say, just from a day-to-day standpoint, from your own experience empirically, that you see some successes in failed sites, which has kind of been a real bugaboo for a lot of
Mm,
surgeons, is especially in, say, failed endodontic treatment sites where there seems to be an issue sometimes
mm,
of repeated failures even after multiple placements. Could zirconia be part of the success, increasing success rates in these compromised sites? That makes us think differently. And I think that's how, right,
mm.
it's how it all starts, right? It starts with, seeing some clinical case successes, trying something, seeing the success. And then I guess there's probably a study in there somewhere, Dr. Aghaloo, isn't there? There has to be a study in it.
Yeah, and it's funny because you're exactly right. I mean, I had a couple patients where implants failed like two or three times, once by someone else. Then I said, "Oh, I'm sure that I can do better," right? And then it fails by me, and then I'm like, "Oh my gosh, are we going to just do it again? The same thing? What can I do differently?" And so I said, "Well, now we have this other implant type of material. Maybe we could do that, but you have to know that you've already failed twice, and so I can't guarantee." And they said, "Oh, I'm desperate. I want to do it." And when you have a success in cases like that, you've already tried it on your most challenging, and so then it makes it a little easier to do it on someone who's only failed once. And especially when you don't have a reason. If you say, "Okay, well, the site maybe was still infected, or
Hmm.
they were smoking, or their diabetes was control, or whatever." But if you don't have a reason, and and the patient's willing to try, I mean, fortunately, most of the time, if implants fail, it's not a disastrous failure if it's one single implant. I mean, it can be, of course, if it affects adjacent teeth and implants, or if it's a full arch case or something. But on the majority of the single cases, if it fails and it just, loses integration or doesn't integrate from the beginning, then you can, take it out and graft and basically start over as if it were a tooth. And so in those cases, it doesn't really make me too concerned to really start over and think about what can we do differently. And I think in the era of all the peri-implantitis too, we're really looking for,
Hmm.
how can we have materials that, even though titanium is super compatible, maybe we want something that's even more compatible, or
Yeah.
are we thinking about some kind of soft tissue seal? And, there are just a lot of things right now, I think, where we're looking for something different to answer some of the problems that we have.
What's great about the Academy of Osseointegration is we have people that are studying, presenting content just like you're hearing right here. And you know what? This is what I get excited about, because we get to hear some of the most innovative people on the planet in regards to restoring and placing dental implants. And I would
And
like
we have
to
new
know,
products, right, all the time.
new products all the time.
That are going to be, the AO has become a place where you can go and you can not only hear the clinical aspects and the 15 years or 30 or sometimes 50 years of research that's presented by some of these esteemed presenters, but you can also hear about the newest products that are being released. Sometimes the AO is used many times as the place to release your new product into the US market, or sometimes into the world market.
And
And so that's something that I'm interested to see what
I'm
we have
wondering,
this year.
John and Dr. Aghaloo, is if this year is the year that we might see something new. In the realm of zirconia, let's talk about that. That's kind of the highlight of our conversation here. Are you excited about someone that's going to be speaking on innovations in zirconia?
Oh, yeah. I mean, I think that, one of my closest colleagues here, Jawan P. and Friends, is going to talk. I think he has a roundtable or a small discussion about zirconia implants. And, he's the one that kind of got me excited about it. And so I think that there are going to be some innovations there. I think another area of innovation that we're going to see at the AO is digital. I mean, that is changing all the time. I mean, from the workflow to the guides to the prosthesis fabrication, both abutment to crown, temporary versus permanent. I mean, there's so much in that right now. So I think that I'm sure we're going to hear about AI and how that's used more in implant dentistry. So I think there's going to be a lot of new stuff, especially because, like you said at the beginning of the show, even though we haven't been together, it doesn't mean that people aren't working on their own, or researching in their labs, or generating and innovating in the industry setting, and then innovating in their offices, because we had more time to think, actually. So usually I think we're so busy with our lives and we're just doing, and maybe even sometimes kind of just like machines going through the motions, but we actually had more time to think during COVID. And I think that thinking time makes us innovate and develop new questions and products and methodology and technology. So I'm excited about that, and to see what people have been thinking about and have them actually show us and talk to us about it.
February 24th and 26th in 2022, we'll be in San Diego. The question is, will you be, right? I'm excited so much about the Academy of Osseointegration meeting. Hey, listen, this is going to be the meeting you don't want to miss, because I really feel like that it's just going to kick things back off. John, you talked about it kind of kicking back off, us doing in-meeting coverage, and we're super pumped about that from a standpoint of you and I, and just diving back in. I know from the passion that I hear it in Dr. Aghaloo's that voices that she's excited as the president to launch back in give us a little send off. Like, tell us what's ahead. Some of the things, the meeting venues are amazing, as you mentioned in our intro. We're excited about that. And then, John, you can close it.
Yeah, I mean, I told you a bit about what to expect in terms of scientific and clinical pearls and the corporate forums. Of course, we're going to see new cool stuff from all of industry, but the social events are also going to be great. I mean, we're going to have the gala on the USS Midway, and we did a tour there a few months ago and went there to see the venue, and the port in San Diego is so beautiful. And the weather is almost always perfect. I should probably knock on wood when I say that, in San Diego. But really, I mean, to be on the deck of that ship, and to be able to host a party there and have an event, and with food and drinks and colleagues and stuff. I mean, it's going to be so fun. And so I really think that everyone's going to really love it. Always our events, our president's event is included in the fee of the meeting. So everybody's invited, everybody's welcome and encouraged to come. And, I want to say hi to everyone, whether we're going to hug or fist bump or elbow tap or whatever it is that, or wave high from a distance or whatever everyone's comfortable with. I mean, San Diego is just such a place to be. I mean, I think that we've kind of opened things up a little slower in California, but the good thing about that is that I think once they're open, they're open. And so, I really feel like things are just going to continue to get better and better. And, all of the protocols that are in place, and the open air location and stuff, and the weather at that time of year here, where it's usually much colder almost everywhere else. So I think people will be really excited to come.
Yeah, well, that's a lot of good stuff, and I think that I almost feel that this is like the first AO meeting right now. It's like it sounds strange, but it's like I feel like it's kind of the way I felt about going to my first AO meeting years and years ago. It was like, because I do feel like you alluded to this earlier, there's been a little bit of stagnation. I mean, let's just be honest. There's been a little bit of stagnation in our profession, personally, professionally. There's just been this, okay, everybody's kind of drawn inward a little bit and kind of just put our head down, just get through 2020 and a little bit of 2021. And I think, with how busy most of us are, it's time to say, okay, what can we take from, there's a huge demand for dentistry right now in most places. So how do we make sure that we are picking back up after maybe 2 years of not changing anything or very little? I don't know. Maybe you have, maybe you haven't, but I think a lot of us have been a little bit in just kind of, okay, do the same thing. Let's get through this time. Now it's time to really evaluate where you are. Come here, get some excitement in your life. That was how I felt at my first meeting. It was like, I'm not really sure what I'm going to learn. Probably a lot of things I won't know, but that's where you want to be. Just enough where you go, okay, I'm doing some things right, but let me be challenged. And then let's go and let's have a drink on the Midway deck and in the beautiful San Diego weather. And let's talk about life, and let's swap some cool stories about what's going on in our practices. And let's kind of reconnect with humanity here and with our colleagues. And I think, be ready to push the profession forward for the next, several years down the road as we kind of go into sort of this reopening of the exciting place we are. So thank you so much for being
Thank you,
with
Dr.
us, Dr.
Aghaloo.
Aghaloo. It's been awesome. And we are super excited thank you for your leadership for AO and kind of where you're taking it. Thank you to Academy of Osteointegration Integration for giving us the opportunity to have you on the show, and also to work together with the Academy in covering some of the meeting and kind of trying to encourage people to make sure that they're coming out and being a part of this, being a part of the organization. We look forward to seeing you there. We'll, very least fist bump, if not hug, for sure. I mean, come on, it's time. Everybody needs a little hug, I think, right now.
I'm ready to hug. So
yeah. Come on. Let's time for that. It's definitely time for that. So we're excited. If you haven't signed up for the meeting, head over to osteo.org and check out what they have to offer. Sign up for this meeting while you can still save a little bit by signing up early. We've still got some time ahead of us to really get this kicked off right. So get signed up for the meeting. If you haven't checked out the Dental Guys, make sure you do that. Go to dentalguys.net. check out what we have going on. Check us out on all the social media outlets. We are everywhere on those. Tell us what you liked about what we're bringing to you. If we're providing some useful content for you, make sure you give us a 5-star rating on Apple Podcasts. We thank you so much for that. Thank you once again to the Academy of Osseointegration. Get signed up. Check it out. For Dr. Aghaloo, for Wes, I'm John, and we are the Dental Guys.